Hi, everyone. It's great to be bringing you our work from Veterans Recovery Resources and how we've been able to provide trauma informed care with a community based integrated behavioral health approach. I'm bringing this to you on behalf of my colleagues, Joe Currier, Aaron Lund, Marjorie Scaffa, and our community partner, John Kilpatrick. Our mission at Veterans Recovery is to remove barriers to high quality and compassionate mental health services for veterans and their families who are struggling with substance use disorders, PTSD, and other common co-occurring conditions. Some general background related to our project is that we have limited availability of culturally sensitive and effective mental health care options for veterans. This represents a major public health issue in our region of South Alabama. There are an estimated 64,000 veterans residing in the 8-county region, which represents about 10% of the region's population. Up to half are struggling with substance use disorders, PTSD, and other co-occurring health conditions. Less than half of those with a probable need for treatment access existing care options. And limited engagement in treatment and premature dropout are normal when services are used. Additionally, many veterans are not eligible for VA healthcare and lack health insurance or other resources. To better conceptualize barriers in our mission, we've constructed a framework that addresses how we view these barriers within Veterans Recovery Resources. And we view these barriers in terms of both the veteran and the clinician. We view those for the veteran in terms of psychological barriers as well as practical barriers, and the psychological barriers and practical barriers of the clinician as well. To deliver on our mission, we've developed a clinical framework that covers 3 separate phases. Phase 1 focuses on safety and stabilization of the veteran. We primarily focus on the physical, psychological, and environmental domains during this stage, or phase rather. And phase 2, we're primarily focused on revisiting and healing, focused primarily on the psychological aspects of health. And then in phase 3, we are using belonging and meaning to address relational and spiritual health domains. We do this across a couple different settings. Residential program is currently under development, and we currently operate out of an outpatient clinic, an interdisciplinary outpatient clinic that covers primary medical services, individual therapy and group counseling, and 12-step programs, as well as offers therapeutic support with physical therapy and occupational therapy, and with peer support services embedded at every step of the process. Services to date have included the treatment of 356 veterans and first responders and family members that have engaged in our services. At the development of this presentation, we had served 217 veterans. Some of the unique lessons that we've learned is that our culture within our organization and mission continue to set us apart from other organizations and within our community. Our social determinants of health are key elements in our decision-making process, and we think in terms of barriers to receiving high-quality care, and we use peer support to often offset those barriers. We realize there's a lot of training that needs to continue, and there's just so little time to complete that training. We do realize that grant funding will continue to be a part of our program sustainability and development, and that we will need to align with long-term community partnerships to deliver the services necessary to effectively continue with our mission. Some of our important next steps are the expansion of our peer support training and services to other veteran support organizations and fire and police organizations within our communities. Hopefully we can begin our intensive outpatient program and residential facility in the near future. We also will continue to provide ongoing training and development of our board members, clinicians, and staff, and finally develop a trauma-informed care framework for our entire clinical approach. So thank you so much for allowing me to present this information to you, and I look forward to seeing you in the very near future.